Welcome to NSA E-Nuggets series, a series of live talks on topics relating to active aging. These live talks will take place every Tuesday and Friday at 2 p.m. here on C3A's Facebook page. You can share this live video with your family and friends too. After the live session, this video will be made available on both our Facebook page and YouTube channel.
Hello, good afternoon, everyone. My name is Xing Yi. I'm graduated from NTU in Biomedical Science and Chinese Medicine close to 10 years ago. So currently, I'm a practicing Chinese medicine physician at NTU Chinese Medicine Clinic. Today, I'm very honored to be here to share with you more about TCM Acupuncture. So before I start, may I know how many of you had experienced acupuncture before? So those who had acupuncture, how was it like? Was it painful, or was it traumatized, or was it very good for you? For those who did not try acupuncture before, you might be curious, what is acupuncture like? Is it painful? Is the needles very scary? Or is it like what you have seen in television shows, just one poke and you might die from it? So no worries about all of this. Today I'll tell you more about what is acupuncture. Okay, so acupuncture in Chinese means it's called 针灸. So actually it consists of two components. One is the 针 portion, which means needling, and the other one is 灸, which is moxibustion component. So today I'll be focusing more on the acupuncture, which is the needling portion. So how does acupuncture comes about? So our ancestors actually used sharpened stones as well as bones. So they will just poke on their bodies, then do trial and error. So once after poking for different points, they actually found that some locations help to alleviate certain kinds of symptoms. So from there, they developed some theories about acupuncture, and that is how our acupuncture comes about. So nowadays, don't worry, we don't have all those stones or such bones to poke on your body. We have needles such as this, which is very sharp and very thin to do acupuncture. So from this left-hand side, you can see that this is called needles. So normally for acupuncture, we'll use these needles on your body. So all these are very thin, of varying length as well as varying thickness. So you've inserted into different locations on your body. From the top right-hand side, you can see here, this is called 梅花针, or you can say that it's dermal needles. And you can see that there's a lot of sharp needles at the head of this dermal needle. So this dermal needle is actually normally used for a lot of situations. So the more commonly seen one is probably for skin problems, skin conditions, such as you have balding hair or probably acne problems. So what the physician does is you use this dermal needle and they tap lightly on your skin until it looks a bit slightly reddish in color, or there may be a bit of slight bleeding. Yeah. So the bottom right corner, this is what we call the lancet needles. So these small sharp needles is being inserted into probably a bit of extremities of your body, so such as your fingers and your toes. So what the physician does is you poke these lancet needles and squeeze out a few drops of blood. So by doing that, it can help to reduce the heatiness in your body or maybe reduce a bit of pain. So one of the most commonly seen points that we use the lancet needles is actually this location down here, which is called 少商穴. So for this is actually what we do, we poke and release a few drops of blood. This can help to alleviate your sore throat. Okay. So what is acupuncture? So simply put, is the usage of insertion of needles into your body. So the needles that we use are actually very fine, as you can see here. There's different length, which can be used at different portion of your body, and different thickness for different users. So it is made out of stainless steel. It doesn't rust. Rest assured, it doesn't rust. And it is sterile. And it's also one-time use. We don't reuse the needles for many times. And after usage, it's properly disposed. And it can come with either tubes or without tubes. Okay. So you might be wondering what actually happened during acupuncture. So before acupuncture, do not have a very too heavy a meal, or do not go acupuncture when you're feeling very hungry. So just take a light meal before acupuncture. And during acupuncture, relax, do not be tense up. So pick up a comfortable position whereby the physician will then put the needle into your body. So once the needle goes into your body, it might feel a bit like a prickling sensation, something like an ant bite. So after that, the physician will actually manipulate the needles. So when there's manipulation, you might feel a bit of soreness, a bit of numbness, a bit of tingling sensation, or there might be even a bit of radiating kind of like sensation. So normally acupuncture will take for around 20 to 30 minutes each session. So during the session, try to relax, stay still, do not move around. So and after that, the session will end. So when the session ends, normally there won't be any much side effects. But some people might feel that it might be a bit more painful for the next 1 or 2 days. Or sometimes you might feel a bit of general fatigue, or there might be a bit of soreness or bruising on the location whereby the acupuncture is being done. And some people might feel a bit of dizziness. Okay, but actually acupuncture is rather safe. So normally these conditions, these side effects may not be seen in a lot of people. It's only seen in a few people. Okay, so acupuncture is normally administered by a registered physician as well as acupuncturist. So it is a very commonly seen service found in most private TCM clinics and charitable organizations. And now in the public sector, you can also actually find acupuncture in these 5 hospitals. So there is also pain management clinics in these 5 hospitals. Okay, so why are hospitals also having acupuncture is because acupuncture is seen as very useful in managing pain management. So more and more people are going for acupuncture services. And there is also a lot of research going on for acupuncture. Like for example, there's this acupuncture treatment of dry eye research being done at the eye center. Okay. Okay. So acupuncture, efficacy of acupuncture. So what you might ask, what does acupuncture does? What is it useful for? Okay. So acupuncture is actually useful for a lot of different kind of treatments. So for WHO, they actually have listed down a list of treatments that they have gone through some clinical trials. So one of the most commonly seen one is for pain management. Yeah. So acupuncture is very useful for pain-related diseases such as maybe knee pain, neck pain, headache, arthritis, or even sprain. So besides pain management, it is also useful to alleviate certain side effects to radiotherapy and chemotherapy, such as maybe dry throat, fatigue, yeah, as well as okay. So besides that, it's also useful for post-stroke recovery, okay, as well as morning sickness, nausea and vomiting, arthritis, allergic rhinitis, as well as depression and some gynecology kind of disease such as like menstrual cramp. So all these listed here are not the only disease that's effective with acupuncture. There are also many other diseases or there's conditions that's effective with acupuncture. And there are also a lot of research going on for the efficacy of acupuncture. Okay, so acupuncture is very good in relieving pain, right? So you might ask, actually, how does it really work? So from the TCM theory, we say that there's a lot of qi and blood in your body. So what is qi and what is blood? So qi and blood simply means that it's something like the energy and the blood flow in your body. So all this qi and the blood brings energy to you, as well as it gives blood to nourish all your organs in your body. So all this qi and blood actually flows in what we call the meridian channels. So when the meridian channel is being blocked up, you might feel pain. So when the meridian channel is very smooth, that the flow in the meridian channel is smooth, there is no pain. So that's why we say 不通则痛，通则不痛, which means that there's no blockage, there's no pain. When there's blockage, there is pain. So what acupuncture does, it helps to stimulate the flow of the qi and blood in your meridian channels. And so it helps to cause the meridian channels to be smooth, so it doesn't cause the pain. So for modern science, there's different research and different theories. Two of the more commonly known one is actually the neurohormonal pathway, which means that actually acupuncture can cause reactions in your nerve as well as your hormonal system, and so helps to reduce the pain in your body. And second theory is that acupuncture can help to reduce the inflammatory markers in your body, and so reduce any pain that's been seen. So acupuncture is also seen as a supportive role in pain management, such as it can be used together with Western medicine opioid, so to relieve any cancer pain, as well as to reduce any side effect that is caused by opioids, such as constipation and vomiting. Just now I mentioned about meridian channels. So you might be wondering, actually, what is meridian channels? So to simply put in layman terms, meridian channels is something like your expressway. So imagine that there's a full whole expressway in your body, whereby it connects the different organs. So your blood and qi is actually the cars. So as you can see here, there's no traffic jam, which means that the flow is good, so there's no pain. So as you can see here, there's traffic jam, there's a lot of cars, so which means that there's blockage. So when there's blockage, means that there's pain in your body. Functions of your meridian channels include it helps to connect all the internal and external organs. It helps to regulate the organ function in your body. And it's also the pathway whereby your qi and your blood flows in your body. So the meridian channels also serve as a protective mechanism against bacteria and viruses. Okay. So acupoints, there's a lot of acupoints in your body, and all your acupoints are actually located in your 14 meridian channels. However, there are some which is called extra points that's not located in your meridian channels. And there's also inconstant points, which is something like your trigger point, which means that whatever pain, then that point will be actually an acupoint also. So besides the traditional acupoints that you are seeing in your meridian channels, you can also see acupoints in your head, your scalp, as well as your ear, as well as in your abdomen, your stomach area. So what does acupoint does? Firstly, it has a local effect. So which means that wherever you poke, it can help to alleviate symptoms that's around the acupoints. The second function is that it can have remote effect, which means that, for example, you poke your hand, it can help to reduce symptoms in your leg. So that is why, because the acupoints are located in the meridian channels, which actually connects from one place to the other. So that's why there is this remote kind of effect of acupoints. The third function of acupoints is that some acupoints can have special effects. So for example, this acupoint called 绕枕穴, which is actually located here in between your second and third finger down here. So this is very effective for stiff neck. So those who have stiff neck, acute stiff neck, so they can do poke this acupoint called 绕枕穴 to alleviate this condition. Okay, so now enough with all those basic theory kind of portion. So now it's more hands-on. So I'll be bringing you through some acupoints in which you can massage and touch, so to alleviate certain kind of conditions in your body. So are you ready? Okay, so now this first acupoint is called 印堂. So you might have heard this word 印堂发黑, okay? But this is not in the very scary portion. So 印堂 is actually located at your in between your two eyebrows. So this is the tip of your eyebrow. So 印堂 will be in between the tip of your two eyebrow at this portion. It's in the middle of your forehead. Okay. So this 印堂, what you can do is you can press with either your thumb or your second finger, and you can press and rotate it in circular motion for around 2 to 3 minutes. So what does this acupoint does? It can help to alleviate probably like headache around this area, or sometimes if you have insomnia, and it helps to relieve anxiety and fatigue. So it's down here, in between your two eyebrows. Okay, and the next acupoint is called 迎香. So 迎香 is actually located at the groove, which is at the side of the nose. So it's this portion. You can feel that there's a groove down here, right? And this is the side of your nose. So it's just slightly at the groove area. Okay. So by rotating this acupoint, it can actually help to clear any like a blocked nose, or probably you have sinusitis, as well as maybe paralysis of your face, and it can help to prevent cold. So to prevent cold, what you can do is you can like rub the side of your nose until it feels a bit warm. So sometimes those who have sensitive nose, who wake up in the morning, that keep on dripping nose, you can also just press this acupoint to alleviate the symptoms. So this is the side of your nose and the groove area. Okay, the third acupoint is called 内关. So 内关 is actually located at the inner side of your arm. So this is your palm, and this is the wrist area. So put 3 fingers at the crease of your wrist. So this is around here. So from here, you can feel that there's 2 tendons down here, right? So the acupoint is actually located in between the 2 tendons down here. So three finger space down for your crease of your wrist and in between the 2 tendons. So it's down here. Okay. So this is also the acupoint whereby you put your anti-emetic band that you can find in your pharmacy. So actually, 内关 is very useful for nausea, vomiting. So car motion sickness. Sometimes you take a car and you feel like vomiting, you can just press this acupoint for 2 to 3 minutes in circular motions. Okay. So this is also very useful for dizziness, insomnia, as well as gastric kind of problem. So 3 finger space in between the 2 tendons is now here. Okay. So when you press it, actually you can feel a bit of suan kind of feeling. So the next acupoint is called 合谷. So 合谷 is located in between your thumb and your second finger. So this is your thumb, your second finger, and this is the edge. So 1 thumb space from the edge of your wedge of your finger. So it's down here. So actually 合谷 is actually very shine. So in order to feel it more, you can actually use your second finger and push up from here, and you press the acupoint. Okay. So this 合谷 is very good if you have pain, such as like headache, toothache. It can help to relieve pain and can help to promote blood circulation and boost immunity. However, those who are actually pregnant women should refrain from pressing this acupoint. So to locate this again, this is the thumb, this is the second finger. So 1 thumb space from the edge is down here. Okay, so the next one is called 足三里. So 足, which means it's at the legs. So 足三里 is actually located at the lower limb of your leg. So at the outer portion of your leg. So you can first find your kneecap. Can you find your kneecap? Okay, so your kneecap has an inner kneecap and an outer kneecap. You can find that there's 2 holes, right? So at the outer side of your kneecap, you can find a hole, and you put 4 fingers from the hole. So from there, it's actually the 足三里. But 足三里 is not actually on the bone itself, it's just at the outer portion of the bone. So it's your lower limb, below your 4 finger space below your outer kneecap, and it's just beside the tibial bone. So this acupoint is actually very good because it's actually called a 保健穴. So it's actually very good because it can help to stimulate and boost your regulation in the digestion as well as bowel movement. It's very good for those who often have constipation or diarrhea kind of problem. It's also very good to improve your immunity and reduce any fatigue that you have. So to repeat, the acupoint again is at the lower limb of your leg. So at the outer portion, so 4 finger space below the kneecap. Okay, so the next acupoint is called 三阴交. So 三阴交 is actually located 4 finger space above your inner ankle of your leg. So this is the inner ankle of your leg. So 4 finger space above that, and it's behind the bone. So 三阴交 is very good because it can help to alleviate digestion problems. It can help in your reproduction problems, and it also can help to reduce any fatigue and any immunity, and can help to boost your immunity problem. So especially those who has like gynecological problems, this acupoint is very good because it can help to stimulate your your menses. So again, to locate this is 4 finger space above your inner ankle. Okay. The next acupoint, 2 acupoints are actually located at your lower abdomen, so below your belly button. So to locate it more specifically, 气海 is actually 2 finger space below your belly button, and 关元 is 4 finger space below your belly button. So if you cannot really locate these 2 acupoints, okay, so what you can do is you place your palm below your belly button and you just rotate in circular motions. Just rub the area of your lower abdomen so that this whole area becomes a bit warmish. Yeah. Okay. So 气海 in 关元 is very good because it can help to replenish your yang qi and your qi in your body, as well as it can help in digestion and reproductive system. So whenever you feel that your lower abdomen is a bit cold, so your digestion is not that good, you can place your palm below your belly button and just rub this whole area until it feels a bit warmish. Okay, so all those are the single acupoints. So I hope that you have remembered. So to recap again, one is actually here. This is called 印堂. Okay, the other one is called 合谷 down here. Another one is called 内关, which is 3 finger space down here. Then there's 2 on your legs, which is the 足三里 and 三阴交. Okay, so next will be a series of acupoints that is good for 3 conditions that you can relieve from. Okay, I'll go through them one by one. Okay, first is for neck and shoulder pain. I believe through the CB period you're at home, sometimes you always feel that your neck and shoulder is a bit painful. So what you can do, you can press these 4 acupoints one by one. So each acupoint press for around 2 to 3 minutes, and repeat these 4 acupoints for 2 to 3 times. Okay, so for the first acupoint, it's called 风池. 风池 is actually located at below your skull. So what you can do is you press the neck and you move upwards towards the skull. So at the bottom of the skull, you can feel that there's 2 indentation, right? So these 2 indentation is called 风池. So what you can do is you can just press it and rotate in circular motions. So this is actually very good, especially also if you have headache or you are catching a cold. The next acupoint is called 肩颈. So 肩颈 is located at your shoulder, in the middle of your shoulder. So this is your whole shoulder, so in the middle of your shoulder, so you can press this. Okay, both sides the same actually. So what you can do is just press and rotate in circular motions. The third acupoint is called 合谷. So it's down here. So between the thumb and the second finger, so 1 thumb space from the groove. So it's down here. And the last one is called 后溪. So 后溪, this is at your little finger. So you can feel the knot down here. So it's just below here. So this is just below the knuckle. So what you can do is you can place it on a table and just rotate this way. Okay. So you can do this for 2 to 3 minutes every time round. So this is little finger, this is your knuckle, so it's just below the knuckle. So to recap again, for neck and shoulder pain, do these 4 series of acupoints. One is feng chi, which is at the bottom of your skull. The next one is called jianjing, which is in your shoulder. Third one is he gu, which is actually between your thumb and the second finger down here. And the last one is hou xi, which is below your little finger. Okay, so the next condition is called lower back pain. So lower back pain, I believe a lot of you have felt about that. So the 2 acupoints that I'm going to introduce is called Shen Shu and Yao Tong Dian. Okay, so Shen Shu, Shen, you know, is kidneys. So this acupoint is actually located close to your kidneys. So it's at your lower back portion. So to locate it is actually at the same level as your belly button. Okay, so this is your belly button. So same level as your belly button at the lower back. So it's down here. So it's actually located at the 2 muscle area at your lower back. Okay, and the next one is called Yao Tong Dian. So Yao Tong Dian is located at your hand. So this is your in between your second and third finger and your fourth and fifth finger. So this is the middle of your 2 fingers. Okay, what you can do is especially if you have acute lower back sprain or anything, you can just quickly press this acupoint. So when you press, it actually feels there's a feeling of a bit of sun kind of feeling, a sore kind of feeling. Yeah. So press it until you feel that there's a bit of relief in your lower back. To repeat again, these 2 acupoints is called Shen Shu and Yao Tong Dian. So Shen Shu is same level as your belly button at the lower back. And Yao Tong Dian is at your hand. So second and third finger, and this is your fourth and fifth finger. So it's these 2 locations. Okay. And the last one is 3 acupoints to help to prevent against cold. So the first one is called Feng Fu. Second one is Ren Zhong. And the third one is Da Zui. Okay. To locate Feng Fu is actually located near to the Feng Chi that I mentioned just now. So Feng Chi is at the neck area. So at the bottom of your skull. So Feng Fu is actually in between Feng Chi, which is here in the middle. So when you press it, actually you can feel that you can feel your the bottom of the skull, and you can feel actually your bone. So it's actually above the bone area. The next is Ren Zhong. So Ren Zhong is actually located at below your tip of your nose. So we can see that there's actually a groove down here. So it's actually around this area. So Ren Zhong is here. So this is actually the acupoint also when you see in television that someone fainted and they just press this acupoint. Yeah. So this is Ren Zhong. So by pressing and rotating this area, it can help to prevent against cold. Because when you rub here, you feel that this whole area is a bit warm. And the third acupoint is called Da Zui. So Da Zui is actually located when you bend your neck forward. You can actually feel that there's this protruding bone at the back, right? So it's close to the neck area. You can feel that there's a protruding bone here. So this protruding bone is actually called your Da Zui. So what you can do is you use your palm and put this whole area at your neck area and just rub it. So rub until you feel that this whole area is a bit warm. Okay. So to recap again, Feng Fu is at your neck area in the middle. Ren Zhong is down here. And Da Zui is at your back, near to the neck area. When you bend down, there's a protruding area. So for Feng Fu, you can just press and rotate it for 2 to 3 minutes. 人中and 大椎 is good that you can rub this whole area so that you can feel that it's a bit warmish. Okay, so that's the end of my talk. So now, very interesting. Let's go to the quiz to see how much you all have has gotten from this talk. Okay, just hold on. Okay, first, so which acupoint is good to regulate digestion? Can you all please type into the Facebook? Just now I mentioned this acupoint, which is actually at the leg portion, which is very good yang shen kind of like acupoint, and it's good for both digestion, especially when you have bloated stomach and when you have diarrhea and constipation. Anyone of you can remember what acupoint is this called? So those who know the answer, you can type into the Facebook. Okay, very good. Most of you are saying that it's 足三里. Correct. So this acupoint is 足三里. So once again, how do you locate this point? So it's at your lower leg, right? So this is your kneecap, 4 finger space below your kneecap at the outer portion of your lower limb. Okay. So next. So when you have blocked nose, remember which acupoint should you massage? It's at this area, at the groove beside the side of your nose. So remember this portion. So when you have blocked nose, when you feel that you are catching a cold, you can just rub this and rotate this portion. So which acupoint is this? Okay, come on. Yeah, correct. So it's called 迎香. Yeah, so 迎香 is located at this groove here. So at the side of your nose, down here. Okay, very good. So and the next one, 肾腧. Remember, 肾腧 is located near to the 肾, which is your kidneys. So it's at the lower back. So where do you find it? How do you locate it? Okay, to recap again. So it's at the same level as your belly button and your lower back. So what you can do is you can press and rotate it in circular motions to relieve any pain in your lower back. Okay, very good. So now is the Q&A session. So anyone of you has question to it, you may type into the Facebook. Okay, so there's this question that say, asking how many sessions does acupuncture needs? So actually it depends on your condition. So there's acute and chronic condition. For acute condition, you will need lesser sessions. And for chronic conditions, you might need longer sessions. So normally we might take 5 to 8 sessions each time round. So for those who are chronic conditions, so it may take more than 5 to 8 sessions. That means 5 to 8 sessions, then you might have a short break before it comes back to another 5 to 8 sessions. Yeah. So there's also a question on whether acupuncture can treat shingles. So, okay, acupuncture is very good in reducing some side effects of shingles, such as maybe the neurological pain. So, yeah. So remember just now I showed you there's 3 types of needles, right? There's one which is called the 梅花针. So sometimes you also use that to reduce any to tap on near the area of your shingles to reduce any pain. So third question is, can acupuncture treat wrist tendonitis? Yes, it does. Because acupuncture is actually very good in reducing inflammation, improving the circulation, as well as to reduce any kind of like pain. So for tendonitis, acupuncture is actually useful, but depending on the condition, sometimes it might take very short, a few sessions. Some might take more than a few sessions. Okay, so there's this question on advising on how to relieve stiff finger joints, especially after inactivity. Okay, so those of you who doesn't really move your fingers, so this is actually a very good exercise that you can do. So 10 fingers, so you just tap. So by tapping here, you can actually stimulate all the organs in your body, because all the meridian channels of your organs is actually connected to the tip of your fingers. So first you can tap this. Okay, so after tapping that for about 2 to 3 minutes, you can try to open and close your fingers. Okay, do this slowly, don't do it too fast, right? Or do it too slow, just do it slowly, open and close for about 5 minutes. So, and lastly, after that, you can just tap your hand, whole arm. So tap the outer portion of your arm. So do this lightly for about 2 to 3 times. Then after that, tap the inner portion of the arm. Do it this way for 2 to 3 times. Okay, so all this can relieve any stiff finger joints after some inactivities. Okay. So there's this question on when you rub in circular motion, is there any direction like clockwise or anti-clockwise or no difference? Okay, so for treatment-wise, actually, clockwise and anti-clockwise, there's a difference. So for clockwise, what we say is 补, which means nourish. So anti-clockwise is 泻, that means you reduce any kind of symptoms. So for example, something that is being 虚, which is something very weak, when you're weak in certain areas, you normally try to rotate in circular motions. So for example, if you often have diarrhea, which means that your digestion system isn't very good. So when you press your 足三里, you rotate in circular motions. So in clockwise motion. Okay. So if, for example, you are having constipation, which means that you are having something that's too much, so it's not a weakness in your body. So what you do is when you press your 足三里, you do it in anti-clockwise motion. So anti-clockwise. Clockwise is the right side. Anti-clockwise is the left side. So remember, if you rotate right side clockwise, which means that it's nourished. If you rotate it in the left side, which is the anti-clockwise, which means that it's helped to reduce any too much of symptoms. So pressure-wise, you don't apply too much until the whole area becomes on tear, okay? So you just press lightly so that you can feel that it's tolerable, okay? But not too much. just press it, it's okay, because actually all the meridian points are actually very close to each other. So for it to be really effective, so of course when we do treatment, there's certain meridians which we should stimulate or certain meridians we shouldn't stimulate lah. Yeah. So but in general, for general health, just normal pressing is okay. So just don't overstimulate. Press one area for like 1 hour. Yeah, just press for like 5 to 10 minutes will do. Okay, so there's this question that this person has a wrist tendonitis and acupuncture treatment helps her recover, but she still feel pain during treatment. Is it normal? Okay, so for this person, because sometimes pain, sometimes if you stimulate this acupoint when you feel, sometimes if you don't feel too much pain in the beginning, which means that your sensation isn't very good. So over time, sometimes you might feel that it's more sensitive towards the acupoint, which means that you are responding well to actually the treatment or responding well to stimulation, which means that it's actually good. Yeah. So this person asks, how long do you rub at each acupoint and any advice to rub with any oil? Okay, so for each acupoint, do not rub for too long. So just rub and rotate it for about 2 to 3 minutes. So at most 5 minutes. So normally, I wouldn't advise to rub with any oil, unless probably if there's areas such as maybe near your nose, which you might feel that there's a bit of blockage. So you might rub it with a bit of oil so as to improve the circulation in that area. Okay. How about dry eyes? Okay, so dry eyes, there's this eye kind of like exercise that you can do. So it's besides dry eyes, it's also good for your eyes in general. So first one is called here at the tip of your eyebrow. This is called 串足. Okay, what you can do is you can just press this for about 2 to 3 minutes in circular motions. Okay, the next is this area at your nose, this area. So what you can do is you can put your fingers and you just move up and down for about 2 to 3 few times. Okay, and the next acupoint is actually at the bottom of your eye. So you feel this is your eye socket, right? So at the bottom of your eye socket, you can feel that there's a hole, indentation down here. So what you can do is you can just press and rotate in circular motion. And the last point that you should do is you press on this acupoint, which is called your 太阳穴. So you just press this and you just move the second finger, just move it this way, up and down, up and down. Okay, do this for about 4 to 5 times. So let me repeat the 4 acupoints. One is 串足 at the tip of your eyebrow. The second one is actually at your nose here. Okay, third one is at the bottom of your eye socket down here. And the last one is press onto your 太阳 and you just rotate your eyebrow and the bottom of the eye socket. Okay, so remember the 4 points. And this next question is, acupuncture can relieve any skin problem. Okay, skin problem, acupuncture, some acute skin problem like very itchy, like there's actually acupoints that can help to relieve the kind of itchiness in your body, like for example eczema as well as some kind of skin problem. But if it's too serious a kind of skin problem, so acupuncture may not be very suitable because it might cause probably some kind of like reaction towards it. So besides acupuncture, probably medication together with acupuncture might be useful for skin problems. Okay, how to relieve pain in finger joints? So pain in finger joints can have a lot of pain. Some is due to arthritis, some is due to rheumatoid arthritis or osteoarthritis, or some may be due to injuries. So if it's injuries, normally acupuncture can help to reduce the inflammation and all of this. Then osteoarthritis as well as from rheumatoid arthritis is also mainly to reduce inflammation, improve the circulation so that you can reduce the pain in your finger joints. So in general, I mean, if you ownself want to reduce any pain, so what you can do is you do some self-massage. So you just, for finger, you just rub up and down. So every morning you just like rub all your fingers this way. So especially your finger joints. Okay. So for those who has like probably trigger finger, you might feel that a bit very hard to close your fingers, or there's pain in closing your fingers. So what you can do, because normally trigger fingers is inflammation of your synovial joint, right? So down here you will just press. You can feel that there's a lump here. So try to press it and rotate it, and at the same time of pressing it, you just move your fingers. Okay. So there's another question on any help for eczema. Okay, eczema is something that might require a long-term kind of treatment. So it requires probably at least half a year of treatment. So eczema-wise, maybe medication might be a bit of a better option as compared to acupuncture. Okay, so hearing loss. Hearing loss, we can probably help in reducing the prolong the length of the loss of getting the loss lah. So probably normally sometimes we will do acupoints at near the ear area, and depending on what kind of syndrome it is, we may add on a few more other acupoints according to the symptoms. How to relieve knee pain? Okay, knee pain normally we can do acupuncture, but if at home, if you want to do, you can just press these few acupoints. So one is, this is your knee, right? So these two portion above your kneecap, you can just press it, and below your kneecap, you can just press it. Okay. So besides that, you can just put your palm over your kneecap, and you rotate in circular motions. Okay, so every day you just rotate in circular motions. So this can help to reduce any like friction, any pain in your knee joints. Okay, any acupoint good to reduce tinnitus? Okay, so just now I mentioned this acupoint Heku, right? Yeah, so you can just press on it to help to reduce, because Heku is good for anything that's at the head area. How much per session and where to look for me? Okay, so this one I'll show you later on our website, which is the NTU Chinese Medicine. So you can just go to the website and just look at the chart on how's the charge like lah. Okay, so you can also go there. If you want to look for me, you can just go there and call in and make an appointment. Okay, so left or right hand, does it matter? Actually left, whether it's left, right, up, down, actually the same. So what you do is can either press one side, or if you want, you can do both sides. So it's like every time round when you're watching television, just do one side. Then after that, then you switch to the other side. So it's the same. Is it possible that you can do more harm if these pressure points are not done correctly? It might be possible, but however, every time round you just do it lightly. You don't do it too hard until this whole area becomes like blue black. Yeah. So, and the ones that I teach you are actually are common acupoints that you can do on a daily basis. So because for treatment wise, normally we don't only do these acupoints. We will do treatment based on probably your syndrome. So what syndrome means that your condition. So those who has for example headache. So headache might have a heaty kind of headache or cold kind of headache, or probably headache due to stress. So depending on which kind of headache, we will combine different acupoints for treatment. So, but in general, the ones that I teach you are some acupoints which are effective for general conditions. Yeah. So where to press for knee pain and sinusitis? So again, just now I teach you all 迎香, right? So it's actually good for the nose area. Then knee pain, you can press just now I teach 足三里, as well as probably areas that's around your knees will be useful. 足三里 is both left and right is the same. So there's actually two 足三里. So one is at the right side and one is at the left side. So any massage for eye floaters. So just now I teach you all the 4 steps for the eye is actually good for all different kinds of eye problems. So especially if you feel that your eyes is a bit tired or anything, you can just press this whole area. So first one is called 串珠. The other one is the 精明, which is actually at the nose area here. Then the next one is here at the bottom of the eye socket. And the last one is the 太阳, and just these two areas. Okay, how to treat eye bag? Eye bag. So eye bag actually also you can do this eye kind of like a massage. Then especially if you can do more pressing around the bottom of your eye to reduce any eye bags. Okay, swollen leg. Swollen leg, you need to diagnose what kind of condition is that. So swollen leg can result from probably kidney problems, heart problems, or maybe it's due to inactivity. So normally what I would suggest is actually you can try to massage your leg. So just push up from your ankle up to your knee. So just move upwards, massage upwards to reduce any like edema in your lower limbs. Okay. So this is the last question. So I hope that you all have enjoyed this session. Okay. So thank you very much for tuning in to this e-nugget series. So if you find this talk useful, please share this video with your family and friends to help them to pick up any useful tips. So to learn more about this TCM acupuncture or other TCM tips, you can visit my clinic, which is NTU Chinese Medicine Clinic. We are located inside NTU, Nanyang Technological University. So, and you can also visit our website at www.tcm.ntu.edu.sg to find out more about us, or you can find out more about me through this website. So, and besides that, you can also visit our Facebook. So at our Facebook page, there's a lot of different tips which we post at regular times, okay, for you to know and practice. So for other learning opportunities, so please visit this NSA website, or you can call this number 64785026 to explore many other training opportunities. Okay, so thank you C3A for this opportunity. Please like us, like C3A website, and you like NTU Chinese Medicine Clinic website. Okay, so thank you everyone.